Hi, I'm Dr. Anna Saylor with Van Every Family Chiropractic Center and located in Rolick, Michigan. And I'm joined by Dr. Marissa Heisel from Spines and Minds in Hanover, Ontario. And we're talking about mood management and using essential oils and chiropractic to make a difference in your moods and your overall health. So thank you for joining me.
Thank you.
Okay, so let's get into it. Let's talk a little bit more about what we can do to increase our mood or help, because I know stress is a huge component right now.
Stress is huge, and I think sometimes when we start discussing mood and mood management, we need to get into the science of that a little bit.
Okay.
As soon as I say that, it scares people
science.
a little bit. I know it doesn't with you, but it does with people.
Okay.
So we need to look at a couple of things. We need to look at the nervous system.
Okay.
That you and I are pretty comfortable with. The nervous system. We need to talk about two branches of the nervous system.
Okay.
The sympathetic and the parasympathetic. You know, the sympathetic nervous system is responsible for that fight or flight that people get into when they get really anxious or really stressed.
That's
that I'm really tense and I need to either run and flee or fight. Yeah.
It's not really.
And our body's response to something like fight or flight, to stress like that, is to decrease digestion, reproductive health goes right out the window, our breath speeds up, our heart rate speeds up substantially, and it's useful in the short term. It's to get us out of danger.
Okay.
It's not useful as a long-term mechanism. You know, back when we would be chased by a cougar, that would be really useful. These days, though, stress tends to last a lot longer than just the immediate acute incident. And so we have cases where people get sort of stuck in a stress pattern and they can't get out of it very easily.
We do find this a little bit more with women. I know I do in my practice. A lot of women that come in are in a constant, chronic state of stress.
Yes.
Okay.
Yeah. I used to do some brainwave testing in my office, and I would be testing women in their 30s and 40s, and they were showing brainwave patterns that were similar to something that we called special forces syndrome. So things that you would see from members of the special forces who were returning from combat overseas.
The same brainwave.
Same brainwave patterns in women in their 30s and 40s.
Okay.
Now you're talking about prime reproductive years. And women who are having that kind of a stress response just by living, you know, a daily existence of trying to balance family and work and running a home and financial stress.
Okay.
That's really hard on a woman's body. That's really dangerous if she's thinking of getting pregnant to the health of the fetus. And it's very wearing. It can't be sustained over a long period of time. I was talking with somebody earlier, and in fact, women's hormones, there are a number. We have 50 different hormones in our body, and we always look at specific ones.
We know the big ones.
Yeah,
they're the
right. So progesterone is absolutely necessary to maintain a pregnancy.
Okay.
It's necessary for menstrual cycles, and yet with chronic stress, progesterone is hijacked in our body, and cortisol starts being produced instead. Cortisol is a stress hormone.
Okay.
So we end up in this cyclical pattern of getting stuck in stress.
And you're not going to be pregnant if you're in that kind of stress. Like,
well,
it's going to be harder to get pregnant,
right? It will be. It will be. And hormonal balance will be off as well. So now you've got a brainwave pattern that's not functioning optimally. You've got hormones that aren't functioning optimally. And we have this incredible incidence of infertility these days, don't we?
Really. I mean, if you look back 20 years ago, it's just night and day difference.
It's exponential these days. And we're talking younger and younger women. Women in their 20s now who are having difficulties. And there are a lot of reasons for infertility. You know, they range from foods that we're eating and toxins in our environment and xenoestrogens, which are false estrogens being produced from food sprays and from plastics and from chemical processes. But another big part of that is stress and our ability of our body to go into a stress state and then get back out of it. And that's where we're really struggling these days, that getting back out of that stress response.
Okay. So what can we do, or what can our audience do to help get out of that stress response?
There are a lot of different things. You know, one of them is looking at the foods that we eat. You know, eating sugary foods, very high carbohydrate foods are going to perpetuate an inflammatory response in our body and an acidic response that's not going to help with healing.
Okay.
So one thing is looking at food. Another one is certainly looking at exercise, isn't it?
Right.
Yeah.
Yes.
So
we know that helps with the mood.
Right.
Okay.
Endorphins and serotonin, neurotransmitters that help with uplifting our mood.
Okay.
So that's essential for working that. And that's, but for some reason that's another stress. When you're already feeling stressed.
Right. How do you make the time?
Right.
Okay.
Right. Doing something that's meditative. It doesn't have to be truly meditating, but even taking 10 minutes a day to be present, to feel grounded. And so that can be one place where we bring in an essential oil. There are oils that are specifically grounding and balancing blends.
A lot of the tree oils.
A lot of the tree oils.
Tree oils,
yep, can be very beneficial for things like that and help center us back into our bodies. Because when we're stressed, we're not really present in our bodies. We're very much in our heads. And we're always thinking about the next thing that we have to do. I joke sometimes that some of my patients have lists for their lists.
Which makes sense.
Which makes sense.
I know I'm a list taker, and I love crossing that off. So
right,
yeah,
right.
So.
And if it's something enjoyable to you, that's one thing. But for other people, it's just an inability to just shut down, to shut their brain down for a little while. And so, what's one of the things that's going to be hijacked with that? But sleep.
Yeah. A lot of sleep issues right now.
There are a lot of sleep issues, and that really works into mood management and mood issues as well. If you're not getting restful sleep, then you're not getting restorative sleep either.
Right.
And so looking at things that are calming and sedating, looking at some of those oils. So
especially before you go to bed?
Before you go to bed,
okay.
Yeah.
Wonderful.
And they can be used in different ways. They can be diffused. You can put a couple of drops of something like lavender on your pillow. You can have a blend that really induces that serenity, things that include lavender and ylang-ylang and geranium, but different blends that will help with some of that. A little bit of vanilla. Those are all really helpful at getting into that more sedating and calming.
Okay.
Some of the deeper tones in some of the oils, things like patchouli and sandalwood, they have a real anti-anxiety effect. They also help with sedation, with calming.
Would you use something like that topically on your skin too?
Absolutely.
Okay.
Yeah,
Wonderful.
absolutely you can. And if you want to, you can diffuse it. You know, it's perfectly safe to have a diffuser in your bedroom if you're using a pure oil that can be on for a couple of hours in the night so that your brain is still receiving and your body is still receiving that therapeutic dose of an essential oil, of a plant-based medicine. And I'd much prefer to see somebody doing that than to see them turning to commercial or pharmaceutical sleep aids.
Sleep aids, okay.
Yeah.
So a couple things with the stress. We want to make sure that we're reducing our stress.
Right.
And you can do that through food. You can do that through an essential oil, exercise, chiropractic.
Yes.
Because we're both chiropractors. And the technique that we do is a very different way of looking at the body. And we, both of us practice with KST, which is corn specific. And you know, we do a lot of cranial work, which directly affect the brain.
Yes.
So we're seeing the stress decrease strictly based on what we're doing too.
Yes.
So
Yes.
let's talk a little bit more about different other things we can do with mood. What about focus? You know, ADHD, we're seeing a lot of, you know, that anxiety kind of behaviors.
And I think we need to be careful because the reality is that there is such an over-diagnosis of things like ADD, ADHD, and behavioral issues. And I come back again to the health of the digestive tract and saying that we need to look at that because that's where serotonin is processed, is in the gut. And serotonin is responsible for mood and behavior in our body. So we want to really make sure that our kids are eating well, that they've got probiotics if they need to help address the health of their gut. But then you want to bring in something that helps induce focus and concentration. There are different blends that will do that. Frankincense is a brilliant oil for something like that. Even something like lime. You know, it might seem like a strange one.
Really, lime?
Lime,
Okay.
because lime is uplifting and it helps with that focus and concentration piece. But bringing those oils in can even be helpful for a businessman who's having to sit through a 3-hour-long meeting, or somebody who's at a seminar or a conference for hours on end. Even as adults, we start to get that head drop and heavy eye.
Wonderful.
Yeah.
And you would say frankincense, I've heard like you can apply it to your temples to make it help even more with the focus. Is that how you would apply it?
So frankincense is an oil that is very, very beneficial internally.
Okay.
It can be, a drop of it can be put on the top of the head. You can put a drop under your tongue.
Okay.
A little bit on the soles of the feet is also incredible for helping to balance the nervous system.
And I heard that with autistic children, on the soles of the feet with frankincense,
Yes.
right? That seems to be really making a difference in our practice.
It does. It really helps to balance and soothe the nervous system itself.
Okay.
And helps to bring people back into their bodies. You know, with something like ADD or ADHD, when there are behavioral issues, it's both an inattention and sometimes a hyperactivity that can come with that, but also a real hyperirritability. So sometimes the environment is just completely overstimulating.
Which is the video games, the electronics, all that induce.
Right.
Let's talk a little bit more about, because a lot of people have anxiety, and I know we talked a little bit more about stress, but let's talk specifically about anxiety and issues that come up with, panic. What can we do about that?
It's a pretty big issue. I have an awful lot of young teenage girls in my practice, 14, 15 years old, grade 9 and 10, with such significant anxiety and panic that they end up incapable of going to school. And sometimes it's for 6 months or an entire year.
At 14 and 15.
At 14 and 15.
Okay.
So I have to look at the internal resources that these kids have and why that's happening so frequently. The other time that I see it as well is when they first go off to a first year of college or university.
Okay.
That might happen. But there's a real increase in the number of young teenagers who are really struggling with something that they shouldn't be looking at, they shouldn't be having to deal with.
Okay.
And so we need to look at different resources that we can help them with, different ways that we can help them. One of the things that I love about the essential oils is it starts to put some of that power back into the hands of the family, back into the hands of the kids themselves.
And the kids themselves can actually use them.
They can.
Okay.
I've got kids as young as 3 who, after their parents have started using oils for them, will say, "Can I have my oil now?"
Yes.
And will try to put it on themselves.
My girls ask for very specific oils at different times now.
And my 8-year-old, when I'm away from her like I am right now and she's struggling with that, will go and find her favorite oils in order to help herself. I love that there are tools that we can give our kids.
You're empowering our children to lead healthier lives.
And we're empowering ourselves, we're empowering families, and that's one of the things that I love about using the oils in practice, is that we're empowering people to start to find a way other than something pharmaceutical that they can do to help with these situations.
A natural, more healthy way.
Absolutely.
Wonderful.
Yeah.
Okay.
Specifically with anxiety, though, you want to look at something that will be calming to the mind, that will help restore some of that grounding, that will help with some clarity, because we often get stuck in a pattern where everything starts to seem fearful.
And we see that. You think about a thought and it just becomes a repetitive pattern over and over and over again, which can then lead to things like addiction and different behavioral issues.
Absolutely. Right? We get stuck in a pattern and our brains sometimes have trouble getting out of that pattern. And we know that the brain is very neuroplastic. It's capable of learning all the time, but we have to give it that opportunity. We have to give it something else to focus on. And so what we want to do, the very first thing that I would do potentially, is to start diffusing oils in the house. And diffusing oils that are both uplifting to mood and yet sedating to that sense of overwhelm. The citrus oils are brilliant for that. They're really helpful to diffuse in the house. Now, they're going to cause an antiviral, antibacterial response as well.
Which is
so at the
awesome.
same time, you're cleansing the air.
Very good.
But you're also inducing that change in the chemistry in the brain so that people can start to come back into a little more balance, back into their bodies, as we talked about before the break as well.
So really quickly, let's go back to the diffusing.
Yes.
You're talking about cool mist diffuser, right? You're
Right.
not talking about a candle and heating the oil, right? Okay.
Because as soon as you do that, you destroy the chemical properties that are useful for the therapeutic benefit of that oil, and you're left with nothing but the scent.
Okay. And they smell lovely.
They do.
But we want the benefits too.
Absolutely. We
Wonderful.
want that chemical benefit because we're using oils that are so pure and so potent. We actually want to utilize them for everything that they can be utilized for.
Okay. So we're going to diffuse it in the house.
We can diffuse it in the house.
Okay. How else can we use it?
We can use them topically as well. So especially some of the grounding blends that will really help bringing us back into our body, that will help ground us to that connection to the earth. Again, when we're anxious, we're very much in our heads. We're not in our bodies, and we really almost feel, even if we're surrounded by people, that we are completely alone and nobody else understands what we're feeling.
Well, yes, you hear that a lot, especially as a teenager.
Absolutely. But even from, a lot of women in my practice who are anxious, they feel as though they're completely isolated and completely alone, even when they're sitting in their family room with 5 people around them.
Right.
And so it's this real disconnection both from the earth and from a greater sense of purpose. From a greater sense of connection.
Too,
That's huge, huge. And so some of the oils that are beneficial for recognition of self, self-love, self-acceptance, those can be really powerful.
You talked about Clary Sage. Was that the self-love? Which one was self-love?
Bergamot, actually, is one of them. Geranium and ylang-ylang can be other ones. Sometimes Clary Sage would be more useful for things like endocrine, for hormone balancing. And certainly when there's significant anxiety, hormone balance goes right out the window as well. And so that might be something that's necessary. There are some blends that can be really beneficial for women at certain times of the month as well. And so things that are contribute to solace, to feeling a sense of balance, a sense of purpose again, a sense of calm.
So let's talk a little bit about that, because we all have, as women, PMS issues.
Right.
So tell me, there's some very specific things that we can do for different times of the month that would help?
There are very specific oils that we can use. There are very specific blends that we can use.
Really? Okay.
Some of them can be really helpful for hormone balancing.
Okay.
And there's certainly a component in mood management that is hormonal. And then when we're talking about something like PMS, that's very much hormonally driven. And balancing through things like rosemary, thyme, some of those cooking oils, those cooking herbs that we always think of, basil, those are all very useful for balancing hormonal health.
That's interesting.
It is.
You can cook and get balanced.
Well, what's interesting with the oils as well, because they're as pure as they are, you can actually use them for cooking.
Okay.
But in this case, if we're talking about using them for therapeutic benefits, they're very helpful for hormone balancing. Different blends, different companies will have different blends that are useful for that as well. And just helping somebody with staying present in the body, not feeling that sense of needing to be in the head all the time, to flee out of the body, making the body feel like it's a safe place to be.
Okay, so let's talk a little bit about depression too, because I know we have so many people that come into our practice and they're suffering from depression, and it kind of goes hand in hand. Like there's the anxiety or the depression, and it can
really be a teeter-totter, can't it?
Yeah. So what can we do specifically? I know the technique that we do, the corn-specific technique, that we can actually really help with depression.
Right.
Strictly because we're working on the cranial bones, and we're doing craniosacral and working with the cranium. It can really make a difference, and they're uplifting their mood. But let's talk about the oils and what we can do to help with depression.
So again, as soon as you're talking about anything with mood, one of the most helpful things would be to diffuse the oils. Now when you're talking depression, there's a difference really that we need to focus on between sadness and a true clinical depression. Because when that is going on, there's an inability to sometimes get up and even shower and walk out your door. It just feels as though every single task is so overwhelming that to even complete one is too much to contemplate. And so finding ways to help with that, and there are different things that are necessary. Really specific talk therapy, sometimes more cognitive therapy, can be very helpful. A lot of people come into the office already on antidepressant medication. Sometimes they've just been given antidepressant medication and they're told that it can take 2 to 3 weeks to start to take effect. When you've got somebody who can barely get out of their own bed in the morning, I don't want to see something take 2 to 3 weeks. That's not sufficient.
We want something to really help now.
We really do, because sometimes anxiety can get to the point of thoughts of suicide. Right? I don't want to be taking the time to get there or see somebody wind up in an emergency department or worse. So diffusing oils has an almost immediate effect on changing mood. Because the olfactory system, because that sense of smell goes directly into a part of the brain that's responsible for mood and emotion, for memory and emotion as well.
And it's one of the only sense. It's the only sense that does that, right?
It's the only sense that causes an immediate reaction in the brain. All of our senses get processed in the brain, but there's significantly more work and more time that has to go into that. The sense of smell, the olfactory route, is immediate. And some oils will even cross the blood-brain barrier. Cedarwood, for example, is one that's fascinating to me because it's something that was used in the spiritual tradition of First Nations people all the time. But the effect that cedarwood has is that it crosses the blood-brain barrier and it affects a neurotransmitter called GABA. And GABA is what we call an inhibitory neurotransmitter. It actually depresses our mood. When we use cedar, it actually helps to reverse that. So we have an uplifting of the mood.
So it's an actual chemical reaction that we're having in the brain.
It's a chemical reaction in the brain.
From one drop of an essential oil.
Yes.
Well, that's really fascinating.
It is.
Versus taking a drug that we might have all these other side effects, and you're
always
kind of on that wheel that constantly trying to get off.
Yes.
Okay, wonderful.
Yeah.
Well, that's fascinating.
It is.
So cedarwood.
Cedarwood would be one of those.
Well, great. My name is Dr. Anna Saylor with Van Every Family Chiropractic Center, and we just got done talking with Dr. Marissa Heisel from Spines and Mind in Hanover, Ontario, and we were really talking about emotions and mood management with using essential oils. So it's been a pleasure, and we look forward to seeing you soon.